Welcome to the Social Safety Initiative's 101 course on social hygiene and public health safety. My name is Dr. Lorelei Walker, and I'm going to take you through this course for what you need to know, what you need to do, and how to do it. So today's world, the stakes are high when going out into public. We're in a pandemic, and this is a pandemic that's unseen to our parents' generation and their parents. Right now, thousands of scientists and researchers around the world race to learn everything they can about SARS-CoV-2 and the virus that causes COVID-19's crippling disease. Society's left in confusion. Changing regulation lags behind an avalanche of data, and resources that are available through the internet and social media become overwhelming. To be usable, this avalanche requires experts and educators like us to pull out that knowledge, to educate, train, and demonstrate what to do and how to do it. Education and training, that's what our nonprofit's all about. We've traveled across the country and observed different social hygiene practices to see what prevents and what increases transmission. We know how to protect ourselves from viral infection, and we want to show you. So our course will equip you with the skills to protect yourself from contracting COVID-19. We introduce you to exactly what you need to know, what you need to do, and how to do it, and show you those simple protocols that you can take into any public situation to drastically reduce your risk of death. We'll show you how to avoid viral infection, but not just for a pandemic, also for those nasty pathogens we hear about every year. Tuberculosis, flu season, chickenpox, measles, norovirus, that darn viral common cold. Now remember, our society has been inundated with natural and biological disasters, especially in the last 2 decades of my memory. If we look back just 3 years ago in the fall of 2017, it was the worst winter flu season the U.S. had seen in 40 years. All told, 80,000 Americans died in just one flu season. So now we're going into fall 2020. And before the seasonal flu makes its entrance, COVID-19 has already killed over twice that number, 200,000 Americans. That's more lives than the U.S. territory of Guam or every single person in Salt Lake City, Utah. So if you're ready to learn how to protect yourself from the seasonal flu, the common cold, pink eye, mono, and SARS-CoV-2, the Social Safety Initiative is here to teach you and train you on social hygiene. Now, you're probably wondering, who is the SSI? Yep, you've never heard of us before. That's because we formed specifically in response to SARS-CoV-2's pandemic. So let's talk a little bit about who we are. Our Council of Directors is a tight-knit group of researchers, educators, and action-oriented leaders who have pulled our unique collection of experiences into one organization with a mission to empower everyone to practice social safety. Our staff are accomplished researchers, community partners, educators, and union leaders experienced in health equity. Our Director of Microbiology, Dr. Ryan Walker, holds multiple publications that advanced our understanding of cancer and genomics, stemming from his research at Tulane School of Medicine. Myself, the Council of Advisors Director, hold publications from research at the University of South Florida and at the University of Washington School of Public Health Genetics. I've covered genomic literacy, government data sharing, and evolutionary life strategies. Each one of us has over 10 years of research experience. But research isn't all the legs of the table. For the last 10 years, I've been engaged with local, state, and national civic and government organizations. I've served on the board of the Tenants Union of Washington State, where we focused on creating housing justice through community-based education, empowerment, outreach, leadership development, organizing, and advocacy. In serving on the board of the Sound Alliance, the partnership of 20 faith, labor, health, education, and community organizations dedicated their efforts to building everyday civic leaders to take action in their communities. The Health Equity Circle is our next generation of doctors. We developed a course and have sites in 7 states to build those community skills for power and organizing so that doctors and medical providers can collectively take action on health equity in their communities. And finally, I served on the board of the Martin Luther King County Labor Council. That's the central body of labor organizations in Seattle. One of the fun things I had the experience to do was to be a community advocate and leader in the early days of the NIH's Human Genome Research Institute's Community Engagement in Genomics Working Group. This work group aimed to engage communities to ensure that genomics and genomic medicine benefit all. So now, when COVID-19 hit our shores, I was representing workers. As a union rep for public health clinics in King County and as coalition co-chair for the Coalition of King County Unions, with 5 colleagues, I co-bargained the county-wide safety provisions for all workers in the county. This included increased security, upgraded personal protection equipment, paid time off to care for family, and hazard pay for the workers staffing the quarantine sites. I was focused on advancing health equity. And in doing this, there was a big push that I led to change local and state policy. I championed the King County's outdated labor policy revisions, and we codified wage parity for protected classes within the county for equal pay for equal work, and something very novel, wage parity for historically oppressed occupations. Now, what does this health equity component mean? It means that labor unions now have access to the training that ensures all workers are represented. It means our colleagues who spend their days standing under tents swabbing a constant line of anxious patients, sometimes without life-saving PPE gear on because supplies were low, will not be financially penalized as compared to other professions. It means the wage gap for the majority and the minority will no longer be the status quo. So, that's a little bit about us. Now, focusing on germ warfare, why now? Germ warfare has been going on as long as we've been human. Zoonotic viruses that cause pandemics aren't that common, and SARS-CoV-2 is especially unique. That means our generation isn't that well equipped. It's okay if you don't know what to do. This is new. So what we're going to do is we're going to teach you. We're going to teach you where to go for local statistics so you can monitor your risk and weigh your options on going out into public. We will show you how to interpret the data to be able to make real-time decisions that potentially have real-world consequences for yourself and your neighbors at your local store. Let's look at the stats from this worldwide battle. The SARS-CoV-2 virus and its resulting COVID-19 infections has globally infected 30 million people 9 months in. This is an inherently conservative number as it's based only on those tested. It is still equivalent to the entire state of Texas or every single resident of the country of Australia. I'm pretty sure that's an entire continent. Globally, COVID-19 marches towards 1 million infections. Globally, COVID-19 deaths march towards 1 million. Now, 200,000 of these deaths are on our shores. Globally, the U.S. has had the largest proportion of COVID-19 deaths and leads all other countries for the most infected people. We've been hit harder than India, even though we only have 1/4 of the population. This course will teach you how to interpret those trends, these predictions, those demonstrated, just like you see here, by Johns Hopkins and the CDC. There's other resources we'll walk you through, such as the University of Washington's Institute for Health Metrics and Evaluations. As you can see here, we'll show you how to interpret this real-time data on daily infections. Now, this is a great resource because it provides accurate projections for different social scenarios. On this graph, you will see the infection number peak right before our national quarantine. When mandates began to lift, the summer months brought confusion. While Washington was reopening parklands, Florida was reopening indoor dining. The resulting infections and daily deaths, those counts differed drastically, and I was there to see both of them. Public health transitioned from an immediate sprint in the spring into a marathon, summer now into fall, in germ warfare. Now we'll review those projections, and they'll show us what we're getting ready for, because coming into fall, we must watch the trends, prepare ourselves, and practice social safety measures, as another virus, the seasonal flu, makes its annual entrance onto this battlefield. Now, in our course, we dive deeper into the what, when, where, how, and who of the coronavirus. Here you see data from the University of Washington's Institute for Health Metrics and Evaluation. Now, we'll show you how to interpret these results. They're real-time statistics on daily infections. This is a great resource, as it provides accurate projections for different social scenarios. On this graph, we see the number of infections peak right before our national quarantine. Now, when the mandates began to lift and the summer months brought confusion, while Washington was reopening parklands, Florida was reopening indoor dining. The resulting infections and daily deaths, those counts differed drastically between states. If we look at the projections from the same institution, we can see on the left that as of mid-September, if you took mandate easing, as we look at death projections from now until January, getting us into flu season, the institution has mapped out what we could expect if we have our mandates eased. You can see we're in the orange now, but coming into January, if we're not careful about social hygiene and safety protocols, we move into the deep red. And we'll teach you what that means. So, in our course, we dive deeper into the what, when, where, how, and who of the coronavirus. This virus is like nothing that we've seen before. It's in one package, and we'll teach you what that package is, what it means, what it does, and why it's scary. So learn the ins and outs of the armory this virus carries, why it's deadly to some and not to others, how it jumps between species and people. Because once you know this, it's easier to spot the risk and shift the odds in your favor. So how does our organization equip you for success? Well, here's what we do. We provide education. We give you the information you need to make your own risk assessment. We'll train you how SARS-CoV-2 and respiratory pathogens travel in the air, in these high-risk zones in your social surroundings. Once you know how it works, where it sits, and how it travels, then we can take you through some simple protocols when used collectively that will reduce your risk. We'll make it easy to understand what you can do when you're disinfecting, where you put your head when you're talking interpersonally, what it means to wear a mask, what kind of mask it should be. And don't forget about your ventilation and your light source. We'll show you why these things are important. And education training is only so good as long as you have the gear to use it. So to match our education and training, we have partnered with an organization who can get us subsidized gear, worker grade gear, military grade gear, athletic grade gear. Before the CDC was considering mask regulations, we partnered with a business who makes high-grade worker. When I was representing the clinics in March and saw this happening, our clinic staff and medical assistants didn't have access to barrier masks. The hospitals needed every surgical mask that could be found. So I reached out and partnered with a textile company in Las Vegas. And we created a mask. It's not just any mask, though. It's a worker grade mask. It's made of very specific material, and we'll tell you more about that. Not only is the material important, but how you wear it is too. So we're going to take you through the important pieces of how to use gear such as a mask or an elongated mask that covers your neck. We'll take you through when to use diffusers, what kind of cleaners to use, where that cleaning should be done, and why it's important to have reusable gear. And we'll also show you how to get access to subsidized gear, because we've ensured that there's a stable supply chain for eco-friendly, reusable, worker-grade safety gear and equipment that we subsidize to make this gear accessible for all. We've already donated over 1,000 different masks to organizations around the country. So, when we look at why now, it's a realistic option that we might have to close up society to stop transmission. 14 to 30 days of no interactions might just allow our public health professionals to isolate, treat, and contain that virus. But realistically, that's a monumentous feat. We don't really have the collective ability and financial stability for all 330 million residents of our great nation to pull that off. What we can do, though, to terminate the viral highway that currently extends from person to person is practice social hygiene. This will allow us to be at work, to go to our local families' restaurants, to go to church, most importantly, to get our kids back to school. Getting my 6-year-old back to her first grade social cohort is critical to her cognitive development and the mental health of our family of 6. So that's what we do. Education, training, and access to gear. Because this will reduce your risk, my risk, and therefore all of our risk of transmission. So, meet me over in the next lesson. Learn more as to why.